Midday Kentucky's Nurse Appreciation Week is brought to you by Clark Regional Medical Center, a place where nurses love to work.
Hey everyone, I am here at the Clark Regional Medical Center and I am here with Tara Bentley, and she is a cardiac rehab nurse, and we're in the cardiac rehab department right now. Tara, welcome to the show.
Thank you. Thank you very much.
Now let me ask you first of all, what exactly is cardiac rehab and what does it take to be a cardiac rehab nurse?
Okay. First of all, for those of you who don't know, cardiac rehab is a physician-supervised exercise activity after the event of a cardiac episode, such as a heart attack, a stent, valve replacement. So basically, the way I like to call it, it's road to recovery, pretty much, for those who have had a cardiac event. And I've been here at Clark for several years, having ER experience here at Clark. ICU, and then when we opened this new service line, I wanted to be the first to get my hands on it down here.
I bet.
So we came down here. I did from the ICU, and we've been open a little over 15 months.
Good.
So we've graduated about 75 participants from the program already.
Very good.
Yes.
That's awesome. Now let me ask you, what exactly, as far as with being, if someone is watching and they want to be a cardiac rehab nurse, what kind of experience or qualifications do they need in order to make that happen?
Gotcha. You definitely want to have critical care. You want to be able, because we do a lot of telemetry monitoring where we put the patients on a heart monitor. So you need to have those skills to recognize in quick thinking matters, you know, if something is going wrong with your patient. So you definitely want to have a critical care background, as well as we have specialized training yearly as well as throughout the year to keep us tidy on our toes for our patients.
Which is important.
Yes.
And okay, so let's talk about, as far as with your job, I would think that it would be very difficult, but also very rewarding. What is the best part about your job, would you say?
The best part about my job is my patients. They, you know, they help me as much as I help them, you know, in this type of environment. We build a lot of relationships. When you come in for your enrollment, we want to make this a very individualized experience, okay? Because not everyone's going to get the same exercise plan as what you may need or what I may need, okay? We have service patients anywhere from 35 years old to 96, so a very wide range of patients.
Right. So let's talk about your day. Walk us through what a typical day here at the clinic would look like for you.
Okay, as the patients come in, we check their weight, which is very important with cardiac patients. You know, you could have fluid buildup, and also we want to check their blood pressure, their oxygen levels. Those things are very vital before beginning exercise. And then we hook them up to the heart monitor, like I said, just to kind of get a baseline to see what's going on, and then we monitor them throughout each exercise. They are continuously on the monitor. Someone is always on the monitor looking at them, looking for any abnormalities in their cardiac rhythm and rate. And so if something were to happen, we actually have a medical director here who can intervene at any minute.
Gotcha. Well, thank you so much for having us. We really appreciate it, and thank you for all you do as well with all of your patients.
Thank you.
Thanks to everyone over at Clark Regional. Wonderful people. It was great to see them, and for more information you can contact Clark Regional Medical Center. Their information is up on the screen right now, and coming up we're going to be looking at what's popping in entertainment. You're watching Midday Kentucky. Keep it right here.